I'm Nick Soman from Decent. Right? Yep. There it is. And there's really two things that you should know about me. My parents are family practice doctors, so Decent is my last chance to make them proud. And my parents are family practice doctors, so I am not trying to change doctor behavior. I have learned. I grew up with two family practice doctors in the Pacific Northwest, and I watched them get ground down almost to paste by the fee-for-service system. I watched them move into medical executive roles. My dad retired as the chief medical executive of Group Health Cooperative, 650,000 member HMO in the Pacific Northwest. His name's Mike Soman. That's my mom, Sarah Faulkner. I love them both a lot. My dad would come home when I was a kid, and he'd say things over the dinner table like, I just don't think the insurance side of my business cares about the patient. And I'd say, Dad, pass the potatoes. But I saw what that meant and sort of grew up with a little bit of that rallying cry. And it hit me pretty hard on a personal level a couple times in my life, honestly. This happened once when I was 4. I usually don't talk about that. I got Guillain-Barré syndrome. It's probably the only audience I'll ever talk to. I don't have to explain that GBS strips the myelin sheaths from around your nerves so they can't take signals from your brain. I was intubated. I was in critical care. I was then moved eventually into rehab. Twice in my life I had to learn to walk again. It was really, really rough. And I bring this up now because I am 100% values aligned with the DPC movement that insurance in its current incarnation, combined with misaligned incentives and thoughtful but not well thought out regulations, is creating a drain on the American healthcare system and interrupting the doctor-patient relationship that needs to be at the heart of care. I will stand in front of you all and say, I think the primary function of insurance as a way to pool risk so that we're not all hoping to be the one that doesn't get Guillain-Barré syndrome is itself noble. It's the implementation and the incentives that suck. And I am trying to build something that offers a better option because had I not had some form of coverage when this happened to me the first time or the second time, it would have been really rough to go GBS with the existing options as a non-insured patient. I've been talking to a whole lot of DPCs here today, and a couple of them have told me the number one question I get from members who are prospects, well, gosh, I'm going to come do this with you. Do I also need some form of insurance? And there are some good options out there that are new. I was just chatting with Jamie at Sedera. Number one, I'm an ally to anybody that's trying to make healthcare more affordable. Number two, that guy's awesome. So outside of those, there are a couple options for people when they go outside of that direct care setting that hopefully does expand over time. There's the cash pay and pray. I hope that I can negotiate something I can pay for. That wouldn't work for me at 4. It wouldn't work again at 29. And then there's the double dip where you go get the major medical insurance and you're paying twice. And I know members don't like that. I've got my insurance. Doesn't that cover primary care? Well, yeah, it kind of does. Well, then am I just paying you on top of that? Yeah, you are. We wanted to offer something better for people. So we built Decent, which is fundamentally a wraparound plan that puts direct primary care at the center. We have a designer on our team. That designer did not design this slide. Right? They say I can't do real things. So, DPC's at the center. We've got a specialty layer, outpatient layer, inpatient layer. We got prescription. RRX is handled by Costco. I mentioned them as a humble brag because they're a really good values aligned partner from the Pacific Northwest like me. They work with a network of 64,000 pharmacies. The number one question I get about our plans is, wait, does this mean I have to go to Costco to get my drugs? No. No, it does not. But they're awesome, and they see the same inefficiencies and misaligned incentives in the PBM space as we see in insurance in general. I want to move it to the background and make it transparent and make it so it's not for everything. So what we've got is a plan where members have a DPC. That DPC is the quarterback of their care. That DPC gets paid their rate. They do not change their behavior at all. Again, influences to change my parents' behavior were unsuccessful. I know. And we're going to support you in what happens outside of the realm of your care. We don't do prior authorization. That's a pretty important point. You're going to be working with members. Thank you. I'm still trying to figure out if you like this or not. And ultimately, here's what's up. Not only is it the right thing to do, but it's my belief that this is the only way that this will work, because the only person that the member wants to hear from when they're sick is their doctor. They don't want to hear from an insurance company. They're not going to listen. It wouldn't matter if they could. So the doctor's at the heart of the care, and we've got the rest of this coverage outside of it. This is not vaporware. We are launched in Austin, Texas. I'll talk about that in a minute. And we recently did a survey with a whole bunch of freelancers, who is the initial target market for us is self-employed people that are buying their own care. Often they make a little bit too much money, which in the state of Texas, about $50,000 in a household means you don't get the subsidies from the exchanges. And people like me, I was working freelance in the Bay Area, and I was paying more for health insurance for my family of 4, my wife Anna and our 2 sons, Ben and Boone, 5 and 2, paying more for health insurance than for rent, which was just broken. So we put this out to a whole lot of different self-employed people in, call it white-collar trades, and asked them, here's our plan design, here's a big insurance startup, it's the one you're thinking of, and which one would you pick? And they liked ours. We're not an insurance company. We're not. I mean, I couldn't say we were if I wanted. That's the great thing about it. And what we are is we are a TPA that we administer plans for self-employed people. Every big employer in this country who's paid any attention to healthcare and realized that they're fundamentally in the healthcare business has realized also that they can save 20 to 30% by self-insuring. All we're doing is taking that same benefit and bringing it to the individual so the little guy can do that too. So we work with sole proprietors, 1099s, freelancers. We'll be expanding that set over time, but that's the set to start. Every member immediately is connected with the DPC, who's the quarterback for their care. I mentioned no prior auth. This is real plans that cover real needs. They're ACA compliant, they're regulator approved. We're in tight with the Texas Department of Insurance. They actually love what we're trying to do. And they're 20% cheaper than the market rates with better coverage too, and that starts but does not end with DPC. We're live in Austin. Seems like everybody knows Chris Larson. I don't know if there are people in this room that also know Chris Larson, but we're working with him. We're working with Dr. Nguyen, who's here as well. And we are early, just getting started. We literally got regulatory approval from the Texas Department of Insurance this month to be able to kick this off, so we're just getting started now. But we have amazing partners like Hint, like Healthcare IP, and like Costco. Got 5 DPCs so far. We're lucky to have some strong venture funding behind us that's excited to see this model work for members, work for doctors too. And if we can show that there's real demand for it, then they want to fund it to the gills. And so we're going to be expanding pretty quickly. We want to work with you. You can learn more at decent.com. You can reach out at hello@decent.com. There's a really sneaky way you could guess my email. It's my name at decent.com, Nick. And we'd love to hear from you. We're trying to make sure this is what you need and this is what members need too. Thank you.